This conference will now be recorded.
So, welcome everybody. The first thing I want to say is a huge, tremendous thank you for Veronique and Kathy kicking butt the last week and taking care of you guys. So thank you for, they're amazing. So thank you guys very much. So today we're going to talk about supportive treatment modalities when you are detoxing. And for the most part, those modalities are going to be natural, or what some people call alternative, and you guys know my view on that. I don't believe what we do is alternative. I believe this is primary medicine. And when you cannot get things under control and your symptoms are so strong that you need a medication or a surgery, we get that, but we consider that secondary. So when we're talking about supportive treatment modalities, there are so many out there, and we do a handful of them at Partners in Healing. But tonight we want to share a couple that you may not know about. We're going to talk about cranial sacral, and we're really lucky to have Kathy Bates here to talk about that. Yay! And then we're going to. And Veronique can talk about massage that she does and reflexology, which I think is really, really amazing for when you're going through detox and maybe not want to have too much deep work done on you. So we'll talk about that as well. We did have several weeks back, we did have Isabel talk about lymphatic massage, so you guys can always look at those videos. We're gonna throw in some unusual things too, and I want you guys to also share any modalities, whether it's something common like acupuncture, or if it's something unusual that you've tried that you've gotten benefit from. So I think maybe before I start, because Kathy was awesome enough to jump on this call for us at the last minute warning, let's bring Kathy on, and I don't know if she's on her phone. Kathy, are you on your phone or are you on the computer?
Hear me? Hello?
Oh,
am I here? Hello?
Here?
We can hear you.
Okay, yes, I'm on my phone.
Okay, wonderful. So Kathy, I would, first of all, thank you so much for joining us at the last moment. I would love for you to talk about cranial sacral therapy. Definitely, I want you to talk about it in regard to what we do here with detox and some of the side effects, some of the healing crises that we might get, and we'll bring those up to you and you can tell us how you might address it. But even, let's just start with you telling everybody about cranial sacral therapy and what the premise of it is, and maybe even how it got started.
Okay, well, craniosacral therapy is a very light touch modality that addresses your body in a light, tender way, addressing the cerebral spinal fluid, the membranes of the brain, the dura mater within the spinal cord, any kind of restrictions within the whole body. It relieves pain. It makes you feel at awe, and it gives you an euphoric, nice feeling. It calms down the central nervous system. It takes you out of that fight or flight state that you can sometimes come in when you're in a panic or a rage. It is great for TMJ, for headaches, for any kind of stress-related issues that you could be involved in, or I mean, it's just a beautiful, beautiful treatment. Yes.
Is there anything that you would not use cranial sacral for? Is there anything you can even think about that you wouldn't use cranial sacral for?
Yes, a current stroke, a brain bleed, or anything like that, you would not use cranial sacral therapy. Yes, so anything on that matter, like if someone was in a recent car accident and hit their head or something like that, concussions, things like that, in the acute stage. we would not use craniosacral therapy. But anything else, it's pretty safe.
How far after a stroke, how much time would have to pass after a stroke that craniosacral would be able to be used?
Well, again, that would determine on the healing process of your own body. Once, if there was any kind of a brain bleed in your brain, then I wouldn't touch you. But once that is all cleared and you need clearance from your physician, then I would be more than happy to work on someone with a stroke. My husband had a stroke. I've worked on him several times. It's a great thing. It relieves pressure in the head, and it helps you focus.
When, who started craniosacral therapy?
Well, originally, it is an osteopathic modality, and it was Dr. Sutherland actually was the originator of craniosacral, where while treating people, he realized when he was touching their head that there was a rhythm, and that because doctors were always taught that the sutures fused in the head. So he said, how can there be a rhythm if things fuse? So he started playing around with the head and realized the different restrictions that were there. And when he corrected these restrictions osteopathically and just with his hands very gently, he found that people were healing from all sorts of different traumas. So Dr. John Upledger was sent to investigate Dr. Sutherland's findings. And when he did he went and investigated, and he realized that there was a rhythm. So he started practicing craniosacral therapy, and of course opened up Upledger Institute and worked until the day he passed away. Dr. Upledger took it a lot further than Dr. Sutherland. Dr. Upledger took it throughout the whole body, is what he did.
So when you talk, and that's where the cranial sacral connection came, right? From the
goes from the
part.
head, right? From the head, and you work all the way down into the tailbone. But within that, because it relieves all the strictures from the head to the tailbone, that also affects every organ in your body and your whole entire body.
So much like I think we might have talked about in the past, when you look at certain modalities like cranial sacral therapy, chiropractic, and acupuncture, they all have a similar goal in that they're unblocking a blockage. In Chinese medicine, it's called qi or qi and blood. In chiropractic, it's called a subluxation, where the spine does not align and then shifts and causes pressure to a nerve. And then, speaking of which, I want to check with the practitioners. There we go. And then in cranial sacral, it is the blockage of the cerebral spinal fluid. So Kathy, tell us a little bit more about the rhythm. What do you mean when you say there's a rhythm?
Well, when in your skull, if you a light pressure on when holding your skull, there is you can feel the restriction. You can feel the flexion and the extension of the skull, and that produces a rhythm throughout the whole body. You can feel it on your arms, on your legs, on your feet. I can feel it on your feet. It's when the body builds up the cerebral spinal fluid in the brain, which is clearing out the brain, and then it is pushed out into the body, and it decreases. So one expands, one it decreases, and it's like a breathing motion actually, and that's what you feel. That's the cranial rhythm, and that is all over your body, from your toes to the top of your head.
So a lot of times when you go to a cranial sacral therapist, they might start by having you lie on the table, and they'll go to face up, and they'll go to your feet or your ankles, and they'll hold them in a particular way to feel that rhythm.
Correct.
And Kathy, tell me, are we looking to see if the rhythm is equal on both sides? Are we looking to see if the rhythm is strong? What are we looking for?
Well, you're looking for cemetery, not cemeteries, cemetery. You're looking for quality of it. You're looking for the pattern. You're looking to make sure it's even. Yes, you want to, because when it's not even, it will show where there is a dysfunction in the body, that it's not getting enough of that fluid, of that movement, the motion. So you want everything to feel even and balanced.
And for our detoxers, what is that fluid? It all comes down to lymphatic fluid, right? It is
Yes.
draining,
It
cleaning.
Yep,
But
it affects the lymphatic system. It affects every system in your body. There is no other system besides the cranial system that will affect everything in your body like that.
interesting, really interesting. So Kathy, I'm not sure if you've worked on too many of our detox patients. Kathy has some limited hours in her schedule to work at the office. But I know for me personally, before I met Kathy, and actually you guys who knew Marie in our office before Marie came to our office, I worked with someone else named Rosie, and I literally, she would work on me and I would see the goiter shrink by the end of the therapy. Because again, knowing that this is lymph and what Kathy just said, you're working on the whole body. So the goiter would literally be smaller each time she worked on me. And then I think that one of the things that Kathy said is really important. Two of the things, and I think they go together, is working on that fight or flight response and the euphoria. Because how the heck many of us feel euphoric in our lives on a regular basis? Not so much. So, and I'm just make sure, oh, that's Kathy, okay. So not many of us feel euphoric in our lives. And truly, and I think Kathy, Therese, and Veronique, and if any of you have done cranial sacral, please chime in. But I think they can both agree that you come off the table feeling that way. And then how many of you guys are dealing with adrenal weakness? If you live in 2020, if you put TV on, you've got adrenal weakness. And so that calming of that autonomic nervous system, that fight or flight, I think is absolutely phenomenal with cranial sacral. Kathy or Veronique, do you want to chime in with any experience on that?
I know that when Kathy works on me doing cranial sacral, sometimes she'll focus on a certain area, whether it's my head or my stomach. And I'll be like, why are you there? Why are you there? Because I'm just curious, like, what's her, and she tells me, well, that's where your body told me to go. So, and she also does craniosacral on my son. And the same with him. Like sometimes she'll focus on his hip, let's say. And she's like, no, he's fine. But there was a lot of energy in his hip. So she kind of had to am I explaining it correctly, Kathy?
Yes, you are. Yes.
Okay. But yeah, I mean, when Kathy is through with me, I feel like I'm floating. I mean, I find it's a very light touch. It's very simple, but I think it's amazing. And also, Kathy, I actually wanted to ask you a question because I know things like acupuncture go well with craniosacral. So if I want to do craniosacral one day and acupuncture a day or two later, it's okay. Does it work like that for all massages? Like if I wanted to do deep tissue or something?
Yes, it does. It does.
Okay.
It doesn't interfere. Anything you do for your body, it's great. It's all good. But you want to give it a few days in between.
Okay.
Because craniosacral can take a couple days to get the full effects of it, and you let your body totally process through what happened. Because your body goes through a process. So you want to give it time to do that before you do anything else.
Okay.
Kathy, I'm going to also ask you something. In Chinese medicine, there's a term that we use, which I think might be a spiritual term as well, but as above, so below. So we can treat things in the face for things in the lower body, and we can treat things in the lower body for things in the face or the head. So with cranial sacral therapy, and granted you are going to the lower body into the sacrum, but can you treat, for example, female reproductive issues? I know with cranial sacral you do mouth work. They literally go inside the mouth with gloved hands and work in the mouth, TMJ and things like that. But does that also reflect to other parts of the body?
Yes, absolutely. It definitely does. In fact, many times I am balancing the pelvis from your skull. I always do a technique with your sphenoid bone, which balances out your pelvis. And I can tell if there's a blockage in your pelvis when I work on the sphenoid bone. And I work on your occiput, it will tell me if there's a blockage in your pelvis. So everything is addressed, and everything is related from one area to the other. Absolutely.
Nice. And so if there were, for example, pelvic issues, like I broke my pelvis many years ago. So if there were pelvic issues that were too uncomfortable to go near at the time, you can work from the head, from the upper body to help release that?
Yes, absolutely. Yes. Yes, you can.
Wow. Does anyone else have any experience with cranial sacral? Have any of you guys tried it?
I see that Claire has a question for Kathy. It
Go
says,
ahead.
is it similar to lymphatic massage?
Is it similar to lymphatic massage?
Yeah.
Well, it's similar. It helps with the lymphatic system, definitely, but it is not quite the same as the lymphatic massage. No.
Yeah,
But it is gentle, and lymphatic massage is also very gentle, but cranial is just a light touch, very light.
And I would say that it mostly focuses on, the brain and the nervous system, where you might put your hands on the abdomen or the throat. I think that more so it's on that focus, whereas lymphatic work is going to be throughout the body.
Correct.
I had a cranial sacral massage once, maybe 5 years ago. My nephew was learning it, and he gave me a treatment. I don't remember much of it. I felt like it was a light massage, but I was very relaxed at the end. That's all I remember.
Well, that's a good thing to remember. Yes.
Yeah.
You don't
Anna,
even
you
have to get undressed with cranial sacral. You just lay with all your clothes on the table.
Yep. Anna has a question. Oh, we don't hear you, Anna. Can you maybe get a little closer? Try that. Hold on. Do I have you? No, you should be okay. Try again. I hear her background voice, but I don't hear her microphone.
Do you want to type it in and I can read it?
Hold on, guys. Okay, I turned Kathy Bates off for a moment. She had some background noise. I'll turn you on for the answer, Kathy, once Kathy Treese reads it.
Okay, from Anna Kiwi, here we go. I have had cranial sacral therapy from an osteopath since I was 14 years old. It's been incredibly transformative for headaches, injury, so that I'm going to study it next year. I just love it. Oh, that's amazing. Really nice.
That's fantastic. Is there an Upledger Institute by you, Anna?
Is nearby in Christchurch, the South Island. First I study osteo, then specialize in cranial. That's amazing. That is so nice.
That is fantastic. Kathy, before we let you go, do you have any advice for Anna and her studies?
I'm thrilled she's going to do this, but I'm curious, is she going to be an osteopathic physician? Yes, very nice. Very nice. So she will have a cranial, she will learn from the Cranial Academy is where you'll go. You won't do Upledger, you'll do the Cranial Academy. Yes, very nice. Yes, I work with some osteopaths and I get cranial from them also. It's very nice. Great. Good for you. Congratulations. Maybe I'll see you one day. That's nice. Beautiful. Great. Good luck.
You know, you guys, that is the beauty of this world, right? This world of natural therapies is that we all see the benefit of each other's therapy and we love it. We absolutely love it. I wanted to bring up another therapy that you might not think about as therapy, but this is something that I think would be really beneficial to everyone. And I do have my favorite aspect of this therapy, but of course you can do any that you like. And that is yoga. I think that when you're dealing with life in general, for sure, but certainly when you're dealing with detox, there are so many physical feelings that you're having. Whether it's digestive issues, nausea, even vomiting, bloating, whether it's headaches, whether it's sleep issues, because a lot of times when you're going through detox, you've got all this extra energy going on. So it becomes kind of hard to rein it in and sleep becomes affected. So there's so many aspects, even the thyroid. So many yoga poses are based on the endocrine system. You can call it the chakras, right? But in essence, it's the endocrine system. So finding a yoga practice that suits you, and I'll just, as many of you know, my favorite happens to be Iyengar, because I feel like Iyengar yoga is not quick, it's not rapid, it's not pushing your adrenals, it's not going to an Ashtanga class, which I think is totally cool as well, but it's not pushing the envelope on your adrenal glands. And there's aspects of Iyengar yoga, whether you're doing a very active class or you're doing a restorative class. There's aspects of it that really bring you down, that slow you down. And I remember that first Iyengar class I took, I thought, you've got to be kidding me. I am going to fall asleep or scream because it is so slow. But then I realized, and which I should have invited Nicole, my friend Nicole is an Iyengar teacher. And she said, for people like me and like maybe some of you who are that type A, always going personality, you need to not go running. You need to not go bungee cord jumping. You know, you need to not go to, boot camp and do those crazy workouts. You need to slow it down. And yes, you can still get a workout if that's what you're looking for, but it's slow. It's about alignment. And what are you doing in your detox? You're realigning. You're realigning your whole system, your digestive system, your lymphatic system. your respiratory system, you're realigning. So talk about supportive. I think that yoga, and especially Iyengar Yoga, could be one of the most supportive. You will see in Iyengar classes, as in many other like Hatha Yoga, you will see restorative classes. And restorative means that you're doing something, but it is a pretty passive something. Even if you're sitting in a, oh gosh, trying to think of the Sanskrit. Veronique might know it. Buddha Konasana.
Konasana.
Say it
The
again.
bottoms of the feet together.
Yes.
Konasana.
Baddha Konasana, thank you. So if you're sitting in that pose, which can absolutely be an active pose, because you've got to sit erect, right? You've got to keep the abdomen soft, but firm, but engaged. And then the soles of the feet are together and the knees are out here. So in a restorative pose of Baddha Konasana, you would have blankets or blocks or pillows or bolsters under your knees so that you're sitting the pose, but you're supported, so that the muscles of the groin can relax, which is going to relax the brain and nervous system. It's going to go back to that cranial sacral connection. But you're still halfway active, right? Your body is lifted, but the legs are supported and relaxed. There's a standing forward bend in Iyengar Yoga where we use a yoga chair, and we might, depending on our level of flexibility, we might put blankets or bolsters on the chair, and then when we lean forward, instead of our hands on the floor, our arms are crossed on the chair, on the bolster, relaxing the mind, relaxing the brain, the pituitary and pineal gland. And yet the legs are active, the quadriceps are lifted, the legs are being pressed backwards. These are really good ways to get your nervous system back on track. Whether it's because you're having insomnia or you're having anxiety and stress, maybe the pain that you're experiencing, it becomes overwhelming. So giving part of the body that opportunity to rest and let go while the other part is active can be really, really beneficial through your detox. So I wanted to mention that, and I know that Veronique has done Iyengar as well, right, Veronique?
Yes, I love Iyengar Yoga, even though it's not something that I practice all the time, but I think it's such a great technique, modality especially for beginners, because you learn every pose is like really practiced in depth. So you have time to adjust to your body's needs, and it's really wonderful. I mean, there's no way you can hurt yourself in an Iyengar class, really. I don't think so.
I don't think so either.
So it's wonderful because you have all the props and you can take your time, and there's no pressure of, accomplishing all the asanas in a certain rhythm. So it's really great. I really love it.
And Veronique mentioned the props. For anyone who's kind of nervous about yoga, if you've never done it or you've gone to a class and you felt intimidated because one person's touching their hands on the ground and you're at your knees, the beauty of Iyengar Yoga is it has nothing to do with the end result. It's always about being in the moment where your body is. And there are all those props. I can actually pull some out of my closet, but there's bolsters and blocks and chairs to support you so that your pose is done correctly and eventually you go further. So it's a very good supportive modality, I think, for your detox process. Just raise your hand or let us know, have you practiced yoga and have you used it during this time with your detox? Awesome. Harm, I know Harm does Tai Chi and Qigong. Harm, do you practice yoga?
No, it's sort of counter productive when you practice Tai Chi.
Oh,
It's because it basically well, that's at least my late master mentioned that it's you practice you create a different kind of body. The I practiced quite a lot of sensing hands with it, sort of a Tai Chi play with other persons, with yogis, or a lot. But I had some experience, and one example came to mind. There was a guy who could sit in a double lotus effortlessly, and when I played with him, he was actually very stiff, or I would say he was not stiff, he was hard. And in Tai Chi, you create a very soft body. So the relaxation is really by softening. Whereas in yoga, in my experience, people are very flexible, but they remain hard. So and in Tai Chi, it's just to create a different kind of body. So.
And you know, it's interesting that you say, because I completely see that comparison. I will say that I think Iyengar might be different, because if you Google Iyengar, Iyengar, you will see that his body, even in his youth, because a lot of the pictures that'll come up and the videos that'll come up might be when he was older. He passed away in his early 90s, I think. But you will see that his body is different than our concept and what we've seen in very westernized yoga. There is a softness and a suppleness there. They talk about the muscles being able to melt around the bone. So I agree with you, Harm. I think that when we use yoga in that Western mindset of workout, you will get that that hardness to the body, and sometimes the flexibility is not in the muscle per se, it's in the joint, and that's not a healthy flexibility. So when you mentioned the lotus position, you know, that flexibility could be coming from the joint and not necessarily the muscle being supple. That's a really good point. Kathy, you want to read? I see there's a couple of...
Yeah, there's a few very interesting ones. Jessica L. wrote that she does Vinyasa and Yin, and she's going to give Iyengar a try.
Cool.
Anna Keeley wrote, yes, try to do yoga at least 10 minutes or more every morning on my walk in the bush. I love my Soar Yoga sequence and have printed out the sequence so I can easily follow it home. That she learned it in the studio first. And then she continued to write, in my experience, it depends on the type of yoga you practice. And that she also did Qigong for many years. Wow. And then she wrote, I also now do yoga with a Vedi master, which is pre-meditation yoga and is extremely soft and all about relaxation, not about stretching or straining anything. Interesting.
Like Ayurvedic, is that when you say Vedi?
Vedic. It says, my feeling as it comes down to how a Western teacher interprets yoga teaching.
Yeah, I think that's a really, really good point. And we see that again, that westernization of everything can really make the body not what it needs to be. And I think that can slow down digestion and cause, you know, a lack of a deep ability to take deep breaths. So very interesting. Tell me if anyone else, maybe Veronique wants to talk a little bit about reflexology, and then you guys can share any other supportive modalities that you've done during your detox or before it. Oh, there you go.
Reflexology is an amazing modality that is really, really helpful to bring the body in a state of balance, because in each foot you have a micro map of the whole body, organs, body parts, and the whole endocrine system is mapped out in each foot. And we have, I forgot the exact number, but we have so many nerve endings in each foot that are actually connected to each body part, glands, and organs. So you can really work on everything with astrology, reflexology. You can work on the head for someone who had a stroke. Oh, thank you, Rosanne. Yeah. So in each foot, on the top of the toes, like Rosanne is showing on the chart, you have the brain, sinuses, the ears, the eyes, the throat, the thyroid, on the bottom of the big toe, and then you have the lungs, the breast, the heart, and then you have the digestive organs, liver, stomach, spleen, pancreas, and then kidneys, urethra, bladder, and then on each side of the foot, on the inner part, is representing the spine, and then on the outer part of the foot is all the nerve connections connected to the spine as well. So there is really and when you work on someone's feet, you can feel sometimes some little crystal deposits inside the feet, and that indicates some hardening of a portion of the foot. So that indicates that there is a congestion there. So you can work on a lot of different things, and it's actually very powerful when you do a series of sessions, because you can definitely help someone. For example, if you experience, I'm giving you an example that comes to my mind, hemorrhoids. If you have hemorrhoids, you can help for someone who has hemorrhoids. You can help with headaches. You can help lymphatic congestion, someone that has swelling of the ankles or the legs. You can work on that. So there's like so many things you can help with.
Digestive issues.
Digestive issues, thyroid, hyperthyroid, hypothyroid. You can definitely stimulate the thyroid or bring it down to more, more calm thyroid. And then what else can you work on? Many different things, not just physical. You can work with pain, with really like stress, heart palpitations,
asthma,
anxiety. It's very, very powerful. And there is another modality that I heard about, and I actually from Dr. Morse. It's called the Lymphatic Massage, and it's based on kinesiology. It's based on chiropractic work, but I have a picture here. I can show it to you. Can you see that?
Mm-hmm.
yeah.
So these are nerve points that are connected. You can stimulate the lymph by stimulating the neurological points that are connected to the lymphatic system. And so you actually stimulate these points going from the top of the skull all the way down to the spine. And you stimulate these points with clockwise movements, and you work like about every 2 inches. And so that is very powerful, also very similarly to reflexology. It's a way of stimulating the lymph and in each area of the body where you have congestion, the organs and the glands. So it's really powerful, and we don't think about it, but it's something that you can even have someone do at home. And for those of you that are interested, I'm happy to scan that document and send it to you guys. And but I really want to start implementing that at Partners in Healing, because I think it has a lot of value, and it would be a great connection, connection with the reflexology, even the cupping. Cupping is amazing for lymphatic congestion that you may have in your chest, in your upper body, or even on some lower body parts. What else? There's another modality that I will start also implementing. It's called, it's a massage with herbal balls that are steamed, and it's actually applied on the lower body, like on the around the pelvis and the legs, for people that have lymphatic congestion on the lower body. So there's like all kinds of technique that you, if you know a practitioner who practices some of those, you can ask them to work on you with that. And then the last one also, I always forget about the ear candling. Ear candling is amazing when you have congestion in your head, like sinuses, headaches, vertigo, dizziness, anything like that. So you can really, sometimes even hearing, you have a hard time to hear in sometimes on one side or the other. It's very powerful. Like, you would be surprised of how much wax come out from ear candling. Sometimes I do 2 or 3 candles and the same amount of wax comes out on each side after 2 or 3 times. So that's another powerful modality.
Yeah, I love that, and I love, you know, Veronique has got so many modalities in that realm of massage therapy that she's done and learned and become really an expert in over the years. So I think that you guys who are not here in South Florida, you know, looking into, you know, finding someone who's got that expertise. Listen, there's a lot of talented people out there who went to massage school and just got out and are ready and excited to work. But if there's something in particular that you're looking for, the cranial sacral or the reflexology and neuro-lymphatic work, definitely interview those practitioners in your area and look and ask them about their experience. I mean, if you were going to hire someone to be, you know, to babysit your kids, you're going to interview them, right? You're going to want to know their background. So the same thing here, but there's wonderful, wonderful modalities out there that can really help you guys through your hardest part of detox, through your healing crisis, but also, you know, afterwards support you in your lifelong dedication to your health, because it doesn't end at the end of your detox, right? This is your lifelong journey. And these modalities have been around for thousands and thousands of years. Yoga has been around, kind of like acupuncture and Ayurvedic medicine, you know, 3,000 to 5,000 years. Massage therapy, at least I learned in Chinese medicine school that the Chinese also invented massage. They also told me they invented pasta, which really pissed me off as an Italian. I drew the line at pasta. I'm sorry. I'm sorry. You guys can't take credit for everything. My teacher found no humor in that. But, you know, these modalities have been around a long time. And yes, they've been perfected. If you think about what Kathy Bates was talking about, I am certain that someone else somewhere felt that cranial pulse or that cranial rhythm and maybe never put it together in the exact same way as Dr. Sutherland and then eventually Dr. Upledger. But these therapies are amazing. And again, I will say one more time that when you think about healing the body, not treating the body, but when you think about healing the body, and the thought that these therapies and what we do and what you guys are doing right now with detox, the thought that this is alternative is really such an incorrect way of looking at these therapies. These have always been primary. For the indigenous people around the globe, these have been primary sources of therapy, whether we're talking about water therapy, right? Going into moving water, going into hot baths, natural, what's the word?
Hot springs.
Hot springs, thank you. Whether we're talking about touch, whether we're talking about food therapy in Chinese medicine and Ayurvedic medicine, herbal therapy. I mean, animals go to search out certain herbs when they're feeling ill. These are primary medicines. And the use of drug therapies and surgeries and radiations and things like that, those are alternative. Those are when you have reached your limit and you've tried, you know, as far as you know, every aspect of natural medicine, and you have to resort to a surgery or something like that, which we'll never judge you for that. But those are, you know, your last options. So these therapies that the ladies are talking about, that Harm talked about when it comes to Tai Chi and Qigong, these therapies are very healing. We had Marie, who did cranial sacral in our office till she retired at the end of 2018 at 70 years old. But she also did medical Qigong. So there's a way of tapping into that energy and affecting change in the body in that way, one person to another, as opposed to the person themselves doing a Qigong practice. So many things, so many ways, and I really want you guys to delve into that if you haven't yet. Veronique.
I forgot to add for anyone, if you do not have the opportunity to actually reach out to a practitioner, if you can look in your area for a sauna, being in a sauna is also amazing. If you can find a place that is, you know, a good place for you to go maybe once a week during your detox or every other week, and get a good sweat, that is also a wonderful thing for you to do during your detox.
Absolutely. And one last thing I'll mention, I did invite Barbara again, too late. We'll make sure we get her on for the next, when we have this topic again. But we have someone in our office who does something called theta healing. And I don't really get it. I mean, I could wrap my head around cranial sacral and rhythms. I could wrap my head around pressing on the feet. If nothing else, it feels good, right? But I can wrap my head around that. Theta healing is something extraordinarily amazing. It is tapping into our energy. It is tapping into our soul, our spirit. And it is something that really I experienced, and I think Barbara was on with us several weeks back, a couple months back. But I had dental work for the second or third time, I think it was the third time over several years, that triggered horrible TMJ to the point where I decided on Sunday morning, I'm just going to walk my dog and walk it off. And that only made it worse. And she came to my house and treated me. And there's an aspect of talk therapy, but it really is asking the higher power to come in and cause healing, if that is what is for the greatest good of the person. And I can't tell you, from excruciating pain to no pain. So, you know, that's something else you guys might want to look into, is theta healing. Does anyone have any questions? Or Anna, go ahead. She's typing.
Can you hear me now?
Oh, yeah.
Yes.
Yay, I switched computers. It's a new computer and I clearly don't have it set up properly. But yeah, I just want to say as well, I just started seeing Barbara and her theta healing in the last 3 weeks. And yeah, it's just been such an amazing pillar and so transformative. So Thank you. But I heard of her speak on here maybe a month or two ago, and yeah, she's amazing. Just to kind of really clear any emotional baggage that we may, emotional, spiritual baggage that relates to our physical body has been really key in my healing. I just wanted to add as well, I'm not sure what you'd call it in the States, but we call it here applied kinesiology, which is like a specialist in muscle testing that can treat the emotional, spiritual, physical planes. And I have a chiropractor here who specializes in that. She doesn't really do adjustments anymore. She just specializes in that. And she's been really key as well, like another key part to my healing, I feel. And she's been really good to, I checked in with her every week when I started my detox, and you know, she's helped to look into my genetics with methylation pathways and, you know, all these things that we, as well as like, you know, spiritual, emotional things that are kind of blocking for me, and helping to clear those and really coming into my own power, which I think this whole healing journey is so much about. So yeah, they've been really amazing, and of course lymphatic massage. So yeah, those are kind of my added pieces to people that have been helping me so much.
I love that. I so love that, because it, you know, that old saying about raising a child, right? It takes a village. It really takes a community to get us to the point, to help us, to support us to the point of true healing. It's not always quick, it's not always easy, but every single physical body, every one of those 100 trillion cells, and the energy and the spirit that encompasses them has the ability and wants to heal, really wants to heal. So sometimes it's a bit of letting go. I know that I have been in my life a control freak, I think. And so letting go and having other practitioners come in to help me was extraordinarily important in my healing. So thank you for that, Anna. That's wonderful. Anyone else before we finish up?
Yeah, I'd like to share something. It's not really supportive, but I also study the works of Dr. Walker, whose juice formulas you use as well in the Partners in Healing curriculum. Yeah. And on one page, he mentions and he gives specific juices for specific ailments, amongst others, in one of his books, especially the ones on vegetable and fruit juices. And he mentions that he's got specific formulas for specific glands, but in the book itself, he doesn't give those formulas. So I just received the endocrine glands chart that he made up, and it's only $10, but it's got for 15 different glands, 15 different, all kinds of different formulas, vegetable juice formulas for the pineal gland, the liver, the prostate, the ovaries, etc. And I'm really quite excited about it. So if everyone wants to sort of tune in to various glands with various juices, then it's really about vegetable juices mostly, but it's really good value for money. That's what I would say.
Harm, where did you get the chart?
Well, I thought it was out of print. That's what it said, but apparently you can get it from Norwalk Juicer. If you Google Norwalk Juicer, then and they still have all his books. Some were out of print on Amazon, etc., but they still have everything, and it's darn cheap. So.
I'm looking to see if I have my copy in here. It must be in another room, but it's Dr. Norman Walker was, Harm, I think he was a naturopath. Is that true?
Yeah, he's basically the inventor of the juices, of the vegetable juices, and he lived to about 100 years old, roughly, give or take a few years.
Yeah.
And he never saw one medicine, and he's really into to colon therapy as well. and he's really quite a character. He did a lot of good work for humanity, I think. So.
He really did, and you can actually download his book, Fresh Vegetable and Fruit Juices. If you just Google that, Fresh Vegetable and Fruit Juices, Norman Walker, and add PDF to that, you can actually download his book, which is really amazing. And very, very simple recipes, and you can basically look up the ailment. There'll be numbers next to that ailment, and those numbers will then be connected to the number, the juice recipe. So number 1, 2, 3, I think number 1 is carrot juice because he uses carrot a lot. And so it'll give you those numbers. You'll see 1 or 2 numbers, 3 numbers, maybe that are bold, which are your primary, and then you might see others that are just regular, which are your secondary juices. But amazing guy. My understanding is he lived to, as Harm said, at least 100, 102, 3. The book, Fresh Vegetable and Fruit Juices, I think was written or published in the 30s, in the 1930s. Wow. So the man is amazing. The juicer that you can buy today, his juicer is called the Norwalk, which is short for Norman Walker. And that's if you have a couple of extra $1,000 laying around, you can buy his juicer. But the premise of his juicer is that it is that there is no heat generated in the processing of the juice. There's one part of the juicer that just masticates, just breaks up the fruits or vegetables. And then the other part, the other half of it is a press. So all of that masticated produce is then put in a mesh bag and put into the press. It's a hydraulic press. My husband and I actually bought a press once, just the press that you can hand do, when we had a juicer that you could just masticate the produce. But then that hydraulic press comes up and it basically cold presses your juice. It is probably the best juice you can have. It is also extraordinarily time consuming and, as I mentioned, quite expensive to buy the juicer. But I have a friend actually who bought one, and it's pretty amazing. But he was a genius, really, really genius guy. So check him out as well. All right, you guys, as always, it's a pleasure. Oh, yes.
Anna wrote a question. She has a question on healing crisis. Should we be worried if we are getting to a point of feeling great, but not feeling too many extreme crises?
That's a really good question. And I'll give you my 2 cents and then Veronique, you as well. It's kind of like pregnancy. Of course, I'm going to have an analogy. So I do a lot of fertility work, and women come in and, you know, they discover they're pregnant and they're nauseous and they're vomiting and they're doing all their morning sickness stuff. And they're like, okay, yuck, morning sickness. And my answer is, you wanted to be pregnant, here we go. Then you have the real far extreme who has morning sickness all day. And that's really tough, and we have to work to treat that with acupuncture, and even cranial can help with that. And then you have the women who have no morning sickness, and they complain because they're fearful, because they say, well, maybe there's something wrong with the pregnancy. I don't have morning sickness. And the truth of the matter is, everyone is different. So some people will have a really strong healing crisis, even if they've not even incorporated herbs. Just going on a clean diet, just going on an alkaline diet, or even just going on a vegan diet, from a standard Western diet to a vegan diet, even if it's vegan pizza, some people will have a healing crisis. Others can go to the extreme of all raw food and juicing and fruit and sitting on a mountain and meditating and not have a healing crisis. So it definitely isn't something to be concerned about, and there's always ways that we can push the envelope a little bit more, whether it's with doing some fasting, whether it's with changing herbs, GI broom. So there's other things that we can do, but it doesn't mean your body isn't detoxing and healing. Veronique, do you have anything to add to that, or Kathy?
No, I agree with you. It's very, very personal. And I have patients that have vomiting, headaches, and some others have nothing. And they're asking the same question that you do, Anna. So when I have a patient like that, I know I can push the envelope further. So like Roseanne said, you can give like GI broom, you can start doing juicing, fasting, you know, things like that. And you know, don't worry, something will come up one day anyway.
No, thank you. The first 3 weeks were really tough. I had a lot of not tough, but I had a lot of symptoms of tiredness and feeling moody and all those things. But what am I, 6 or 7 weeks now, and I'm feeling pretty good. And I just thought, should I be doing more? You know, should I be doing more? But I think I'll just enjoy it for a little bit. And it's that A+ personality as well, where I'm like, I want to do this to the max.
Yeah, enjoy that time, because you know it may happen like in a month that something may come up out of the blue that you're not expecting at all. I don't even know what kind of example I could give you, but you know, everybody's different. So yeah, enjoy that time. It's great. You know, your body is cleansing anyway.
And to do one more analogy, because I just have to, sleep while you're pregnant, because once it's born, sleep is done.
That's right.
All right, you guys, have a great rest of your day or evening, and we look forward to seeing you on Friday.
Bye,
Thank you,
guys.
everybody. Good night.
Bye-bye.
Good night. Good night. Good day.
Bye.
Good night. Thank you for having me.
Of
Thank you,
course, thank you,
Kathy.
You.
Kathy, for coming.